Hey, this is Earl. I'm sorry if I've left you hanging a little bit. A lot's happened since my last video. In my last video, I told you that I have a cancer diagnosis, and that still is the case. I go tomorrow for another biopsy. I'm going to biopsy 2 places on the right side tomorrow. And so I'm having top surgery a different way. I'm having a double mastectomy, and it's really disappointing, seems like a tiny word. Going to Florida and having the surgery with Dr. Garamoni was like a dream come true. And now it's free. My insurance is paying for it. So let me catch you up a little bit. The surgeon that I had 2 weeks ago is no more. She is uncomfortable operating on me because I'm transgender. I know what you must be thinking right now. Yeah, that's not legal. That's discrimination. She wasted our time, and she scared the shit out of us, and then she dropped us. So I've thought a lot about how to handle that situation. And I've thought about going to the state medical board. Some friends want me to sue her. I'm not going to sue her. But what I am going to do is something that I think will benefit the most people. And I'm going to write her a letter. She never physically examined me. Her nurse said, in a minute, Dr. Smith is going to come in, and you'll take off your shirt, and she'll examine you, and then we'll come back in her office and look at your films. And that never happened. And in the second meeting, it didn't happen either. And I know it didn't happen because she didn't want to look at me. She didn't want to look at me in the eye when we talked. She didn't want to answer questions. She didn't want me as her patient, and she let me know that. What I wanted from her is to be direct and say, I'm not going to do your surgery. So, because I wanted that on the record. And she wouldn't return my phone calls. So, a professor of mine, I texted her that night, the night my therapist dumped us, and she emailed some people at UNM Hospital, and that started the ball rolling, and a team was put together to help me, and they've been wonderful. I have a surgeon that I really like. I feel 100% comfortable with her. She's really smart, confident, and she's not uncomfortable with me at all, she said. And neither is anyone else. I think enough people know my situation there. I'm sure they're this sweet to everybody, but they're really going out of their way to take care of me, call me Earl. We had to, right now, the name on my insurance is still my birth name because we didn't want to confuse things with the nature of this particular situation. But after my biopsy tomorrow, I think I'm just going to go ahead and change my name everywhere. And the reason I want to do that is because there aren't enough of us, well, thank God, there aren't a lot of us in this situation. And I want to handle this as myself. And it's just, I mean, it's hard enough to put on those little pink scrubs they give you, and it's like girl power everywhere, and I love girls. But I just feel very out of place in this setting. And so it will help me to have my name. And I want to represent. I want to go through this as a trans man and deal with it as a feller. So I'm doing that. It's been hard to imagine what my chest is going to look like now. It's been hard to. Pretty sure I've given up having nipples, and I was really looking forward to having a chest that looked masculine. And now I'm not sure what's happening in that regard. The surgeon I have is really good and makes beautiful incisions. She's not a plastic surgeon. If I wait for a plastic surgeon to try to do what I want to do, then I have to wait maybe 2 or 3 months, and I don't want to wait 2 or 3 months. Not because I'm afraid cancer is going to take over. I'm not afraid of that. I'm afraid of not finishing my last year of grad school, and that means a lot to me. My work means a lot to me. So now it looks like maybe reconstruction later, maybe tattoos. And it'll be my chest. It'll tell my story. So I'm getting used to that. So I'm having surgery 2 days after my 53rd birthday. And I'm going into this 53rd year flat. And I like that. So I'm not going to talk anymore about the cancer, the treatment, because more will be revealed in that way. There's more tests to be done. We don't know if it's on both sides. And I don't know yet if they'll want to do radiation. I can tell you, I'm pretty sure I'm not going to do radiation. But not because I think it's not like I don't want to do it because I don't want the quality of the rest of my life to be poor, any of that. It's just that, and I may do it. I took a friend today to her radiation appointment, and I know she's getting better. I have no doubt she's getting better. And it's working. It's working for her. I feel it. And it could work for me, and I may end up saying yes to it. But right now, I'm leaning more towards the surgery, and then oxygen IV and vitamin C IV, going back to a raw vegan diet, exercise, and watching it. I want to watch it. I think that my body can heal itself. I'm a firm believer in that. And I want to give it a chance to. So that's where I'm at on that. I was supposed to be teaching right now, but I gave up my teaching contract. Ugh, kills me now, because the other doctor, the mean doctor, was pushing things so fast that I thought I can't continue to teach. And then I could have finished. It was only a month, and it would have been money that we really needed right now. So yeah. Sometimes we have plans. And sometimes I wonder why even make a plan. My wife likes a plan. She likes to know what we're doing. Like she used to, like on a Saturday morning, she would say, "What do you want to do today?" And it would always annoy me because I really don't like planning. I just like living. So that's where I'm at right now. I'm just staying in the moment as much as I can. Over the past couple of weeks, I've had moments of terror and depression and sadness, deep sadness, even feelings that don't make a lot of sense, like shame, guilt, inspiration. So I felt a lot of everything, and there for a while I was feeling a lot of depression and sadness and anxiety and fear. It would come in waves for the most part, and I'm glad that didn't last too long. That's a really hard thing to feel. I think testosterone helps me deal with my emotions. I know it does. And for the past few days, I've felt really good and healthy and very happy with my surgeon. She was compassionate and gave me a really thorough physical exam. She's really gentle but thorough. And I feel well taken care of by the team at UNM Cancer Center. But nothing. My transition is going this way. That's how it goes. I haven't stopped taking testosterone. I was telling a friend that last Thursday when I gave myself my shot, I was shaking because I was a little bit nervous that it wasn't good for me or it would make the cancer grow or whatever. But now I'm not afraid to take it. I am going to work with someone to balance my hormones. We're going to maybe do an estrogen blocker or some natural estrogen depleters. But I need, at this point, right now, I need it. And I'm hoping that I find someone that I can add to my team that can work with me on the hormones and find a safe balance. I also believe that testosterone might have saved my life by lowering my estrogen level. They're worried that it converts on a cellular level, but they don't know. And I have a feeling that it helped me. Certainly getting a screening for Dr. Garamoni found this situation. So far, my transition, you could argue it saved my life. So I feel a lot better than I did when I made the last video. And I've got the biopsy tomorrow, and I've got my surgery July 13th. But I'm going to check back in with you June 30th for my 6-month update. Be well, and I'll see you soon. Bye.